Uh, yeah, next 25 minutes or so, I'll try to go through and discuss what's been going on with COVID in China through the course of the epidemic, but with a particular emphasis on the last couple of months, which have been rather disastrous, as the introduction mentioned. Uh, Everyone, I think, is aware that China had a zero COVID policy. That is, that if they found a COVID infection, they would basically quarantine the person, lock them away, and basically keep them until they had recovered. Now, the reality is this was a much harsher regime than something as simple as that. In reality, all local officials were tasked with controlling all outbreaks with minimal social and economic disruption, although they weren't very successful at that, obviously. This was done by a combination of testing and quarantine for anybody coming into the country, extensive testing within the country. There were green codes that were an app-based way, basically, of tracking your COVID status, whether you had COVID, whether you had been exposed to COVID, whether you were a remote contact of a person with COVID. And so depending on those situations, you would only get a green code basically if you were far removed from COVID, and you needed the green code to go into stores, to go into restaurants, to go into public transit, to travel. And so everything was really controlled by that app on your mobile phone that gave you a code that gave you access to things. Whenever they detected COVID, they did major lockdowns. Okay, and there was very aggressive contact tracing and mass testing associated with this, and I'll give you a couple examples of that during this talk. They had masking, distancing requirements, vaccination requirements, gathering size limits, dining restrictions, etc. In short, it was one of the harshest COVID control regimes that the world has ever seen. And for a time, it actually worked fairly well. Okay, it's important to remember the original variants of COVID had an R0 of about 3. And at that level, most of Asia was actually able to contain COVID for the entire first year, even before vaccines became available, with masks and a combination of quarantines and contact tracing. And they did quite well. And so Asia, during the first year of the COVID epidemic, had very, very low death rates compared to the rest. Okay. And that was largely because of the widespread use of masks within Asia. Now, when the Delta variant came along, it bumped this R0. R0 is the number of people get infected by each initial infection. Okay. When R0 is 3, each person infects about 3 other people. When R0 is 6, they infect about 6 other people. And that became much more of a challenge for China. Okay. But with that said, it was challenging, but with very aggressive control measures, they could still contain it. So this is an example of an outbreak in Guangzhou. This is the actual entire outbreak. Okay. Okay, so there were 7 generations of this outbreak. Okay, and then they completely contained it. So this is the curve showing how the cases rose and then fell. And even at the peak, there were only about 12, 13 cases being detected. Now, how did they do that? They were very aggressive. Anybody who was detected positive with COVID, they contact traced everybody around them. They did mass testing throughout Guangzhou. So for example, during that period, they did 48.8 million tests total. And this was over a 2-month period. Okay, so they were extremely aggressive. Needless to say, it worked. It actually did contain these Delta outbreaks. There were 2 or 3 other similar outbreaks of Delta that were successfully contained. And so at that time, during the second year of the epidemic, it seemed like this was actually working. Now, it was working at a rather incredible cost. When you consider the cost of administering almost 50 million tests over a 2-month period, the personnel associated with that, the cost of the tests themselves, it's very expensive to do it this way. But like I say, it worked. It actually kept China pretty much open during this period. But when Omicron came along, this approach began to fail. Okay, because Omicron bumps up the R0 significantly. I mean, we actually don't generally tend to quote numbers for it, but it's probably of the order of 11 or 12. And then it gets some additional oomph from the fact that it adds immune evasion. It adds the ability to avoid protections from previous infection or from vaccines. Okay, so that makes it just incredibly contagious. And so even in January, basically, we saw the outbreak. That outbreak occurred. Omicron really came in here. Okay, about well, it was first detected in November, became global in December. And the first outbreak in Xi'an was in January of 2022. Okay. And that was a fairly intensive outbreak. They did manage to bring it back down again with very aggressive measures. But then in March, we saw the massive outbreak in Hong Kong. And I'll talk about that one in a little more detail because that has a lot of lessons for what's happening in China right now. And by March, if you look at this, the numbers seem low here, but it's popping up all over the country. And they're working very hard and they're trying to stamp it out, but they're not succeeding. And basically, by March, they basically lost control of it. And you see it just shoots up like this. This is basically March of 2022. And that was actually a major outbreak in Shanghai and Jiangsu. So let's look at the Hong Kong outbreak first, okay, because this was one of the first early examples of how aggressive Omicron could be. The first Omicron cluster in Hong Kong was found in December of 2021. Or sorry, that should be, December 2021. By January of 2022, they had actually adopted the zero COVID policy of China. Hong Kong had been a little less strict, although they still had very strict quarantine entry requirements and so on. But they got much more severe about their restrictions. And then Chinese New Year happened, February 1st to 3rd. And officials urged people to stay home, but being Chinese New Year, basically people disregarded that. And that's when we saw an explosive outbreak of Omicron throughout Hong Kong. And we see this here. Okay, we're coming up. Chinese New Year was like February 1st that year. And then 2 weeks later, we see this massive spike in cases in Hong Kong. And then there were subsequent mini spikes after that were different variants coming in. Now, what was really worrying in Hong Kong was we saw this incredible death rate. Prior to this spike, Hong Kong had a total of 213 cumulative deaths throughout the first 2 years of the COVID epidemic. Quite impressive. They had kept it very, very low. By the time they finished this spike, they were up to over 9,300 cumulative deaths. So 9,100 people died over a period of a couple of months here. And most of those were elderly people, and the deaths peaked at almost 300 deaths per day in Hong Kong. And Hong Kong has a population of about 7.5 million. So it was quite a high death rate. Now, what went wrong in Hong Kong? Well, what was working against the virus was that Hong Kong did have strict quarantine policies. They had universal masking. People used mostly surgical masks everywhere they went. And they did extensive contact tracing and isolation. Okay, so they were quite good on that. What was favoring the virus was first, Omicron is just incredibly contagious. Zero COVID through the first 2 years, or they didn't have zero COVID until very recently, but their restrictions through the first 2 years meant that there wasn't much infection. And so there was very little immunity from previous infections. So you had it in largely immune naive population. Vaccine uptake was low, only about 64%, and even lower among the elderly, 49%. And the reason for that was that there were concerns that the vaccines were too dangerous for elderly people to take. And so many elderly people did not get access to the vaccines at all. And then, of course, favoring the virus was Chinese New Year coming just as the virus made introduction. Now let's look at how this thing actually happened initially. Okay, around that time, there were basically 3 points of introduction. I mean, Hong Kong tracks things well enough, you actually know pretty much what's going on. First, there was a Cathay Pacific flight crew that violated quarantine. They were supposed to be in a quarantine hotel. They went out to a restaurant, and that started a small cluster. Okay, but that was contained. There was an outbreak among hamsters who were being imported. Okay, and that actually led to the culling of over 2,000 hamsters in Hong Kong. Okay, so it was not a good time to be a hamster if you were living in Hong Kong. And then finally, the one that really seems to have seeded the epidemic was a person who caught Omicron in a quarantine facility. They were in a room across from a person who had an Omicron infection, and somehow through the ventilation system or just the doors being opened and closed, Omicron found its way across the hall and into their room. And it's quite interesting. There's a paper that shows that genomic analysis shows that this final person who caught it in the quarantine facility basically kicked off the 5th wave.
what happened was they went back to one of the, most people are familiar with the vertical housing in Hong Kong, the public housing. They went back to one of those housing units, and then there was airborne infections up and down the housing unit. This was not the first time Hong Kong had seen this. They had seen this before with SARS. Okay. And that basically kicked the whole thing off. And then from there, we know where it went. The case fatalities were extremely high among the elderly. This is showing you the case fatality rate, the percent of people infected who die. Wave 5 is this big Omicron wave. Incomplete refers to those who have not completed their vaccine series. Complete, the green dots, means those who've completed their vaccines. Okay, so you can see very low death rates in the younger populations. When you get into the 65 and above population, the death rate gets quite high. Although if they were completely vaccinated, they still stayed relatively low, only getting up to about 1 or 2% for 65 to 79. They still got up to 11% even with vaccination for those who are greater than 80. Okay, so most of the deaths basically occurred in the 65 and older population. Now, it was possible to open safely because Singapore and Hong Kong gave us a very good example of doing what Hong Kong tried to do, but they had far fewer deaths and cases. And reason is just this graph right here. This is showing you the vaccination rates in Hong Kong by age, red being unvaccinated, in Singapore and in New Zealand. In other words, they made sure that they had reached high vaccination rates, especially among the elderly. They actually did better on that in New Zealand than they did in Singapore, but still, very, very high, 95% plus sort of vaccination rates. And that in turn kept the deaths. So this upper is the cases, when we were actually measuring cases at the time. The red at the bottom is the deaths. So you can see Hong Kong, huge numbers of deaths. But in the rest of the countries, the numbers of deaths were very, very contained. Okay, so they could have opened safely had they been much more aggressive with the vaccines. There's a whole lot of history behind that. There was a big distrust of the CoronaVac vaccine, which China wanted them to use. When Pfizer came in, it became very popular, and they got a lot of people getting vaccinated with Pfizer. But the reluctance on vaccination for older people still remained even within the medical establishment. Now, the same thing happened in China in January of 2022. Okay, what they started seeing was they saw outbreaks around the country from January. They were relatively low in the big scheme of things until we basically got to the outbreak in Shanghai. Okay, and with Omicron's higher infection rate, we saw this massive spike that occurred, this is what, a couple of months after the Hong Kong outbreak. Okay, so another major outbreak. And in responding to that, they locked entire cities down. Shanghai was locked down for 60 days. And when you were in lockdown, people were not allowed out of their homes or out of the areas in which they were supposed to reside. There was mass testing conducted. And as I think most of you are aware from the news, there were problems with food distribution, and protests started building over time. And the ultimate thing I think that broke it all down was the fire in Xinjiang, where on November 24th, where 10 people were killed and 10 seriously injured. And that was kind of the catalyst for protest around the country. And you see, for example, there's one in Beijing, one of the protests. Guy without a mask, unfortunately. So by December 7th, the government responding to these massive protests, realizing that it actually was a huge political problem, decided that zero COVID was history. Okay, so on December 7th, they issued a proclamation with 10 guidelines. They basically reduced mass testing, dropped the QR codes, the green codes that you had to have to go places. Asymptomatic cases were told they can just stay home for 7 days. They don't need to go into quarantine. Close contacts only need to quarantine for 5 days, which means these quarantines are not going to work at all. They're far too short. Lockdowns in high-risk areas were lifted if no cases were seen for 5 days, and high-risk areas were now just limited to units or blocks. Couldn't lock down an entire city. Pharmacies could not close at will, and no purchase limits on medicine were allowed, but there wasn't enough medicine available anyway. They accelerated vaccination for the elderly, although not quite fast enough. They enhanced the monitoring of populations at risk, said that there would be no movement controls in low-risk areas or suspension of services by the government, and no blocking of emergency exits or apartment entrances. The fact that people have been locked in was a lot of the problem previously. And then they launched some improved control measures on school campuses. So basically what they said was let it rip. They basically lifted virtually all of the restrictions that were really necessary to contain COVID, and lifting those restrictions, so quickly has had a huge cost. It was literally an overnight shift with virtually no preparation. Unlike places like Singapore and New Zealand, where they had gone out and vaccinated all the elderly people before they lifted the restrictions, China did not do that. And it produced a national epidemic on steroids. Okay. We saw explosive growth. There are NHC estimates that as many as 250 million people were infected between December 1st and 20th. I honestly suspect that's a little high, probably more like 120, 130, but still millions of people in a relatively short period of time. They believe at this point that half of Beijing's population has already been infected. Some people are saying numbers as high as 80%. But again, there's really not much data because case reporting was completely discontinued in China on December 25th. So they're completely opaque in terms of what's happening. And what we get is really what comes out in news accounts. We know the hospitals in the cities have been completely overwhelmed, as this picture shows. Oxygen supplies have run out. Medicines are largely unavailable. There are some homegrown antiretrovirals that China has produced, but we really don't know how effective they are. They've never actually published good data on the efficacy of those home-developed antivirals. And they basically have refused a license for Paxlovid put on their general availability list. And so Paxlovid is not available to people in China, except basically through the gray market. And there it's costing, I believe, up to $5,000, $6,000 for one treatment with Paxlovid. So it's not affordable to most people. And as you've seen in the news, crematoriums are backing up. Okay, there's an interesting article in the Washington Post a couple of days ago where they actually looked at satellite photos of crematoriums showing how the parking lots were filling up around all the crematoriums across the country. And that was basically Omicron-related things. And the worst part in my mind is that the propaganda messaging has now shifted to tell people that an Omicron infection is mild. And when you tell them that, and then you cover up the number of deaths, you may actually get people to believe that, and then they're not going to take the precautions they should be taking. Now, what should we be worrying about here? First of all, this is clearly a humanitarian disaster of immense proportions. China has a massive elderly population. 250 million people are 60 and older. And if they see the same elder mortality rate as Hong Kong showed, then over 1 million elderly people will die over the next few months. The current boosted vaccination rate among the elderly is only about 50%, with some recent data implying maybe it's up to 70% now. But it's still only about 40% in the 80 plus. This is actually data as of November. So still not very much in terms of boosting. Their vaccines are inferior, for lack of a better word. Here you see the effectiveness of 1 dose, 2 dose, and 3 doses of the vaccines. If people get up to 3 doses, the vaccines are quite effective against severe illness or fatal disease. Okay, even for older people, but you have to get them to those 3 doses. And they also have to be relatively recent because these vaccines wane over time, just like every other vaccine does. So if you were vaccinated a year ago, you probably have lost most of that vaccine protection against an Omicron variant right now. Now, they are using some improved subunit vaccines that they've developed for boosting people now, which do give better protection than a 3rd dose of Sinovac or Sinopharm. And they are also looking at some nasal vaccines, but those are really untested at this point. And we don't have solid data on those. So there are a lot of immense challenges here. There was inadequate preparation for opening. And so there wasn't adequate planning. The messaging moved very quickly to telling people that it was a mild infection to justify the rapid opening. The elderly population is definitely inadequately vaccinated and very vulnerable. And the hospital system was not expanded before lifting the restrictions. And we know the capacity has already been over. This is going to get even worse when people start moving for Chinese New Year, which they already are starting to do, because that will spread COVID very widely in the rural areas of China where healthcare is even worse. Okay, so what's going to happen in the next few months? Let me quickly run through this. Dr. Wu Zhanyou, who's the chief epidemiologist, anticipates there'll be 3 waves. The current wave that's largely in the cities, There'll be a second wave in the rural areas from the Lunar Year holiday travel season. And there'll be a third wave once people return to work after the holidays. And I'm just going to run you through what a few of the models predict and also what they show in terms of the impact of interventions. Okay, this is a paper by Kai et al., which was done in mid-2022 about what would happen when China opened with Omicron. Their baseline, which is this big red one here, showed 1.5 million, 1.6 million deaths effectively, and that they would exceed the intensive care unit capacity by a factor of 15.6. In other words, it'd be nowhere near enough care capacity to handle this. If we look at the number of deaths here under different scenarios, and they looked at things like vaccinating the elderly, expanding vaccine uptake to 100%, closing schools, so on and so forth, most of them, except for vaccinating the elderly and getting vaccines up to very high levels, do not reduce the deaths too much. The deaths still remain at about the 1.6 million level. Okay, so it's really the vaccinations that are going to make the difference here. And that means you've got to roll out high effectively. These scenarios are looking 80% efficacy vaccines. That is not what we have with Sinopharm and Sinovac. They are not, they are more like 50, 60% efficacy in terms of protection against severe illness. And with waning, that's probably down to 30, 40% protection. Okay, so they're not going to see this type of reduction in deaths that this modeling would indicate. These people looked at different strategies. I won't go through this in detail, but again, we see there's only a limited amount of impact you can have on the deaths. And again, most of this was based on looking at improving the vaccine approaches. IHME at University of Washington has projected through April 2023 with 4 scenarios. Their reference scenario, which is the green one here, which is what they think is likely to happen, has this massive spike now, which is what's happened in the cities, followed by an even bigger spike that will occur post-Chinese New Year. And that's basically the rural epidemic. Okay. They have an 80% masking scenario. Strangely enough, masking in China was only at about 60% toward the end of December. So it really wasn't that high. But if you get to the 80% masking, you can bring it down quite a bit. And then if they never reimpose any mandates, get this black curve, which would get them up to 4.5 million infections a day by April. Okay, so not a very pretty picture. And deaths would daily deaths would also grow very, very rapidly in that case. Okay, there's an outfit in UK called Airfinity that does health analytics. And again, you know, this is kind of the wave in the cities. This is going to be part of the Chinese New Year wave. And then they're also projecting another further wave when people return from the rural areas after Chinese New Year. They expect there'll be another wave in the cities associated. And their cumulative impacts were about 1.7 million deaths by the end of April. Okay, so the situation is really very fluid and concerning right now. They lifted zero COVID restrictions December 7th. They removed inbound quarantine requirements on January 8th, so people can come and go in the country right now. January 22nd is the Chinese New Year, but the travel season has already actually started. And over those 40 days, that 40 days of the travel season, billions of journeys are going to be made within China. And that's going to spread the virus to every corner of the country. And then it's not clear how fast the responses to the epidemic are evolving. Most of what we're getting right now is anecdotal reports out of newspapers and media. Reporting of cases was discontinued in December, and we know deaths are grossly underreported. They were reporting 12 COVID deaths in December, which is clearly ridiculous. Now, what are the implications of this for the rest of the world? Well, China has a population of 1.4 billion. That means if 50% of the population gets infected, that's going to be 700 million new infections. That's a lot of infections over a very short period of time. With quarantine on return lifted, many overseas Chinese will return home, the ones who haven't been able really to go home without spending a month in quarantine over the last 3 years. Many will want to return home. And many Chinese travelers are coming out of the country now. There's a very, just as there was in the United States, there's a huge pent-up demand for travel by people who've been locked down for 3 years. They just want to get out and about. Okay. And testing is being required in most countries now for those coming from China, but frankly, it's largely ineffective. It's not really going to stop much of anything because, especially with Omicron, if you test on a PCR 2 days before you take your flight, there's adequate opportunity to get infected between the time of that test and when you actually get on the plane, especially with the virus as rampant as it is right now. So the question then is this a threat to the rest of the world? Some people think it might actually give rise to an evolution of a huge number of new variants, and it might also give a bunch of exported infections largely through these travelers. Okay, let me kind of address those. In terms of variants, most of the evolutionary biologists are actually not that worried about variants in China because it's a largely non-immune population that has very low levels of immunity. And where the evolution with COVID variants comes is really to work around existing immunity. So if you don't have much existing immunity to work around, you don't need to evolve very much. So most of the scientists aren't really too worried about variants coming out of China, but we need to monitor it. Exported infections, the problem is, yeah, if I drop a couple of plane loads of Chinese into another country and say into the United States and 20% of them are infected, well, that's a drop in the bucket compared to the number of new infections we've got occurring within the United States. If I just look at Honolulu alone, right now we have approximately 160 new infections a day that we know about. There's probably 5 times that number, so we're getting close to 1,000 infections per day in Honolulu already that we're growing here at home. So dropping another, 20 or 30 Chinese or HIV or COVID positive into that milieu is not going to make much difference. What really matters is what's going on in terms of protective behaviors where they make entry. And right now in the United States, we have very little in the way of protective behaviors. I would actually turn it around and say, in many ways, the rest of the world may be a threat to the Chinese people. We are the ones who are producing these massively immune evasive variants. The latest one that everybody is worried about, XBB.1.5, is a product of New York. Okay, it evolved here. It came from a variant that came out of Asia, India by way of Singapore, XBB, but its baby 1.5 is much more immune evasive and also much more contagious previous. And there are other variants, for example, in Australia, another variant called XBF and one called CH.1.1, which is also seen in the UK. These variants are much more likely to potentially seed another epidemic in China once they get past their current epidemic. Okay, so I think, the Chinese people have a lot to fear from the rest of the world as well. So just my closing thoughts then. China is in the middle of a major humanitarian disaster. This initial round may easily infect half or more of Chinese population and will probably play out over the next 6 months. After that, I think they'll be in pretty much the same situation as the rest of the world. But there is a possibility of resurgences happening if new variants come in. Deaths will probably fall, depending on whose models you look at, within a fairly wide range of 500,000 to up to 2 million. Most estimates are probably more between 1 and 1.5 million. So we're going to see a lot of deaths, especially among the elderly. And it's all really dependent on how fast they roll out the vaccines. They have not taken offers for the mRNA vaccines from the West. They don't want to use those. And that's unfortunate because those vaccines are far more effective. My suspicion is that China's economic output take a hit while this wave rolls out, but it will probably recover quickly as it burns through the populations and then people get back to work. And I have little doubt that the desire for economic recovery is influencing the Chinese Communist Party's approach right now. They basically want to get this over with and get China open to the world again as quickly as possible. And globally, that means we'll see increasing demands on natural resources from China reopening and starting to import a lot more gas, oil, and other resources. Okay, and I'll just close with a quote from The Economist just about a week ago. You can expect the party to trumpet that the country is swiftly returning to economic growth as COVID controls vanish and to censor and demonize all those exposing its blunders. Already officials offer hollow boast about new COVID policies that put the people first and put life first while busily hiding needless deaths. And I think that really sums up the situation very, very well. And with that, I'll turn it over to Dr. Hornick.
Wow. Thanks very much, Tim. This was a chilling but incredibly analytical presentation. I guess, we have a few questions that are coming in. As the moderator, I get to go first, though. So, is there a way that, let's say, starting in September or October, the Communist Party of China, Xi Jinping, could have prepared for what I guess many people thought was pretty inevitable with Omicron, because massive quarantining, as I've read that, basically, even though they've built hundreds of thousands of units for quarantine, they were going to get overwhelmed. So this was going to happen. What could, from a public policy, your specialty is public policy, what from a public policy point of view, what could have been done different? And maybe, speculate why wasn't it done differently?
Well, I think, the first and primary difference was they really should have focused on vaccines. And they should have especially targeted the elderly. As you saw, if they got up to 3 doses, with a booster, basically, where the booster was relatively recent, the protection was good even for the elderly. Okay, it wasn't as good as it would be, say, with a mRNA vaccine, but it was still good. So in September, had they really stepped up their vaccination campaign, then by the time, they decided to lift restrictions, maybe I wouldn't do it early December, I'd wait till late December, they'd be in much better shape. From a public policy perspective, I might actually want to forestall it until after Chinese New Year, because Chinese New Year, we know, is going to spread it like crazy across the country. Okay. But had they done the vaccinations and put all their resources into getting those vaccines out over a 3 or 4 month period before lifting the restrictions, they would have averted most of the really negative impacts of COVID, just as Singapore did, just as New Zealand did. Okay. And so I think, that was the problem. On the other side, part of the contributors to that was the fact that, yes, their vaccines are less effective than the Western vaccines. The mRNA vaccines are definitely better. The bivalent vaccine is actually better. There's a recent study just came out of Israel that shows the bivalent vaccine reduces hospitalizations and deaths by 81% and 86% respectively. Okay, so had they imported and used the bivalent vaccines, especially for the elderly, it could have massively reduced the death numbers. Okay, but from a public policy perspective, China's not about to do that. The Chinese government, I think for national pride reasons, would not accept importing those vaccines.
Yeah, I mean, there's quite a bit of speculation that there was a concern that they would become dependent on these vaccines and being dependent on Western suppliers. But one of the most puzzling things, and this comes up in a number of questions, the vaccination rates themselves are quite low. I mean, was there disinformation involved in this? As I said to you earlier, this is a government that was willing to weld people's apartment doors shut during the lockdowns, and yet they couldn't somehow coerce or cajole, especially the elderly, to get vaccinated. But
Well, the 2 factors that come in here. Number one, if we believe the numbers they put out, the vaccination rates are not that low. In fact, 90% of the population has received 2 doses of vaccine, of either Sinovac or Sinopharm. Not perfect vaccines. The problem was they received those well over a year ago. Okay, those are old vaccinations. And I've seen some numbers that 60-70% are boosted at this point, but again, most of those boosters were done about a year ago. Okay, and we know that these vaccines wane over time. So the protection, while they may have had, if they got that 3rd booster a year ago, they may have had good protection against death and hospitalization at that point. A year later, that's probably going to be down to the 30-40% level. Okay, so old vaccines is part of the issue here. Lower quality vaccines and vaccinations in the past, not in the recent period. And that's the real issue, I think.
Yeah. So a number of people are asking what you've sort of addressed this, but the impact of Chinese visitors will be on a place like Hawaii, but also a place like Thailand or some neighboring countries. Are there any public policy strategies that would be helpful? You seem not to think that the testing is all that useful. what can we do? What can be done to protect ourselves?
Well, like I say, I think I'm less worried about infections coming from China than I am about homegrown infections. Like I say, here in Hawaii alone, we're generating probably 1,000 infections a day right now. And I mean, that's just the reality. 1,000 people in Hawaii are probably getting infected with COVID, and it's been that way for the last 4 or 5 months. So like I say, one plane load with 20 or 30 Chinese coming in who, even if they're 20, 30% infected, is probably not going to make much difference in terms of our local transmission. Once the virus is in the population, it depends on what the population does to protect itself. And adding a few more infections on top of that's not going to make much difference. Now, if you really want to try to contain those infections, number one, you would not use PCRs 20 or 48 hours before the flight. You would use rapid test at the time of boarding. And you do not board that plane if you don't have a negative rapid test right now. That would be far more effective. Okay, because that 2-day period is a huge period to get infected. Not to mention, there's a 2 or 3 day incubation period before you'll even test positive on the PCR. So you might be picking up 5 days of infections there. With that 2-day earlier PCR test. So I would use rapid test just before. The other option would be testing people on arrival, but for economic and political reasons, we know Hawaii is not going to do that, and other places in the U.S. are not going to do that.
Yeah. Actually, in many ways, I think one of the most fascinating statistics you had was that masking was only about 60% in China.
I was shocked at that too.
Would that? I mean, would that make a difference both there and in other countries?
It would make a difference, but I will point out that was during the zero COVID period.
Oh,
and
right.
I think if you actually look at the pictures coming out of China now, everybody's masked.
Everybody's got a mask, yeah.
But the problem I've got is far too many of them are masking with surgical masks, which are not. They have some impact, probably about a 50% impact on Omicron transmission. But they really need to be using N95s or KN95s. They need to be using higher quality masks if the masks are really going to be effective against Omicron.
Just a couple of people have also asked about the timing of this decision. I mean, you've discussed what could have been done, but do you have any theories about why it happened so quickly? I mean, it was, as I said to you earlier, I mean, following a sinologist, nobody, I mean, nobody claims that they, predicted or could have predicted, such a rapid turnaround.
I think there are 2 factors involved there. First is that the protests were growing and were getting rather massive. And I mean, they're still working to tamp down the protests. There was an article I saw yesterday where they're going out and arresting some of the people. Even today, they're still arresting people involved in the November protest. They've got pictures, they've got stuff, they can find people. So the protest, I think, were certainly a factor because, the Chinese government, despite its authoritarian nature, does worry about the people. It was similar with SARS. When SARS was spreading, the Chinese people were very upset because they were not getting good information from the government and they were furious about it. And the Chinese government registered that. But I would say the other and probably bigger factor was that Xi had already cemented his power at the Chinese Communist Party meeting a couple months ago. And so he can do whatever he wants after that. He basically has replaced the entire power structure with his people now. So it's pretty much up to him what happens.
Yeah. Another question that's come in is, how aware are the Chinese people of long COVID? And what do you think? I mean, you mentioned this again earlier. We'll have these deaths, which of course China will not acknowledge, right now. But over the next year or so, there'll be strokes and heart disease and all sorts of things that are, in addition to things like long COVID. Are preparations, what kind of preparations can be made for that? Whether or not any actually are, I guess.
I have honestly never seen the words long COVID in a China article across everything I've looked at. So I don't think there's much awareness of it. I don't think
there's much, conscious desire to do much about it. I mean, the health system is already overwhelmed just dealing with COVID itself. And I think that's going to continue to be an issue for them for the foreseeable future. They're going to probably be dealing with this outbreak over the next 6 months. And then there'll be subsequent outbreaks, just like what we saw in Hong Kong. Like I pointed out in the Hong Kong graph, we had that massive spike. But then, 3 or 4 months later, there was another spike, which is BA5. Then there was another spike, which is basically the current more evasive variants that are coming out. So, they're going to be dealing with this just like the rest of the world does. They will have these waves of COVID transmission occurring throughout the year. And so I don't, and given their much more limited capacity in the medical system, I don't think they're going to have resources to put into doing much about long COVID. So I would really worry for people with long COVID in China. I don't think they're going to get much in the way of medical care.
So I assume we're not really going to know the toll until a year or two down the line when we can see what the excess death rates are and that sort of thing. Speaking of data, it's one of the earliest questions, and I kind of didn't expect it, but how reliable do you think the data out of Hong Kong are? As we know that the mainland data is on almost any topic is kind of questionable, but what about Hong Kong?
I'd say Hong Kong data is 100% reliable. I know the people in the Department of Health there who do that sort of work, and they are rock solid.
Yeah,
they know what they're doing, and they're telling it like it is.
Yeah,
I really don't worry at all about the data coming out of Hong Kong until such time as we start to see political interference with that. But I've seen no reports of that yet.
Actually, this has also come up. I mean, you know what happened post SARS and post avian influenza in China, and there was this whole kind of raft of literature and analysis about all the lessons that the Chinese learned from that. And did they actually apply those lessons or not?
Well, I think they did in the early days. Just as places like Thailand did, Malaysia did, Taiwan did, most of Southeast Asia, because of their experience with SARS, was prepared for this. Taiwan basically put mask requirements in place within 5 days of the outbreak in China, the initial outbreak. And they were distributing masks from the government. Every citizen would get 5 masks a week from the government. Okay, so the Taiwanese knew this right up front, and that's why, through the first couple of years of the epidemic, they had virtually nothing until we got to these much more infectious variants that then, basically broke, like I pointed out in Hong Kong, it was really one infection that seeded this entire massive outbreak in March and April. Okay, it really came from one infection in a quarantine facility, no less. She was just released. The problem was she got infected in the quarantine facility.
Right.
Got released after 21 days, but that was still, she was still testing negative at that point. She was in her incubation period. Yeah. And then she got released into the community, went back to one of the high rises, and it spread from there.
Right.
So it doesn't take much to see these Omicron things.
Yeah. I mean, those quarantine places were also, anecdotally, there was a lot of stuff coming out of China about people, not being sick, but then getting sick because you're surrounded by, other people. Is China making any progress on mRNA vaccines at this point, to your knowledge?
They are. I mean, they've been working on some, I believe there's 8 different mRNA vaccines that are in process in China. There's one, I think, that's at phase 2 sort of stage, which means it's at the safety and, but not yet at the efficacy testing phase. Right. And, but, that's going to be late basically for dealing with this particular wave. It might be useful in the future against future waves, but it's probably not going to do much at this point. The other thing to remember right now, even if I wanted to vaccinate people right now, where are my healthcare workers right now? They're all tied up in caring for people who are sick. Yeah. I mean, those are not 2 mutually orthogonal groups of people. Okay, so when the healthcare workers are tied up with this, they're not going to be doing vaccinations.
Why, according to your data, the death rates among people over 60 but under 75 were relatively low. Is that something that you would have expected? Is that, you know, sort of across the board, or was that unique to Hong Kong?
Well, that was under boosting.
Oh, okay.
Yeah, so you know it's important to remember, but you know the problem was the older you were in Hong Kong or in China, the more reluctant they were to give you a
Yeah.
boost.
Right. Oh,
You know, so a lot of the 80 plus didn't get well, and it's a medical bias. There is a bias within the medical establishment
mhm,
that these vaccines are very hard for older people, that
mhm,
they're going to cause more complications, more problems,
mhm.
and so you know that feeds over then in turn into the patients who also don't want to be vaccinated.
Right.
But
Right.
the physicians themselves are not really going to be pushing very hard to make it happen.
Yeah. Yeah. I mean, yeah, and there's a lot of skepticism in China and Hong Kong about vaccines. I mean, you know, China had two pretty big scandals in 2016, 2018 with bad vaccines. And actually, friends of mine in Hong Kong were telling me that when they finally got the Pfizer, the BioNTech or Moderna there, a lot of people didn't believe it. They thought that they were just going to be given the Chinese vaccine and told that they're, I mean, so it's, you know, from a public policy point of view, again, you know, communications, I mean, you mentioned this earlier, I mean, you know, the horrible thing about saying that Omicron's not that bad, you know, messaging is really quite an important part of this whole issue, right?
Oh, it is absolutely. And I think, you know, the other thing in Hong Kong, for example, and I know this, you know, I know this from relatives I've got in Thailand and so on, that, you know, a lot of the problem was just a mistrust of the coronavac vaccine when it first came out. People didn't want to use it.
Yeah.
And they took it because it was the only thing they could get, because none of the mRNA vaccines were available in that part of the
Yeah.
world at that time.
Yeah.
But then once Pfizer came in, that became the preferred vaccine of most people, and most people rushed out to get that if they could
Right.
afford it.
Right.
But generally, they would have to afford it. They would generally have to pay for it themselves.
Yeah. I mean, I was always sort of surprised that they didn't use in China and use vaccination status as part of that green code sort of thing from the beginning. It was all based on testing and contacts and stuff. You know, that's one way to get people to get vaccinated. It worked in the U.S. up to it, certainly in places like New York. Let's see.
Well, I think you know they just failed to adapt the system as vaccines became more available. I think part of it was just this belief that, you know, zero COVID policies were going to keep it under control.
Yeah.
So they didn't worry too much about it. Then they didn't, you know, feel they had to push on vaccines as hard as they really should have.
Right. So maybe we'll wrap up with this. What would you tell the Chinese government to do now? Not that they would listen to you, but if you were Xi Jinping, let's put it that way, and since you are now the paramount leader, what would you do?
From a public health perspective, I would shut down travel for Chinese New Year, because I think, you know, that's going to be a massive disaster across the country. That's going to spread COVID to every corner of China. And, you know, and look, people have been locked down for 3 years. They want to travel now. The problem is, I don't know if you could do that without ending up with a massive revolt on your hands.
Mm-hmm.
But the problem is, you know, people are going to be taking this home to their older relatives and their elderly parents and things like this. Real disaster.
Yeah. Stop. Yeah. No, I think you're right. Especially if there isn't a concomitant effort to get ahead of it. Use this time to vaccinate people.
Well, in fact, that's, yeah, I mean, that would be the other part I would say. Lock it down, lock down the travel right now, not lock down the
Right.
people. They can
Right.
still move around within the cities and so on, but
Right.
let's stop the geographic spread. And
Yeah.
then, like you say, use that time to really accelerate the vaccination campaigns, especially in rural areas, to get those people vaccinated and up to
Mhm.
date on their vaccine.
Yeah.
You know, they all need to have at least 3 doses recently. You know, the third dose has to be recent.
Right. Right. Just one final one that's just come in. Is there? Do you expect that there will be vaccine tourism from China? You know, there was some of that early on in COVID. Will Chinese be going to Thailand, for instance, to get the, get the BioNTech or whatever?
It's already happening. I mean, there are businesses opening in China that are catering to, or I mean, in Thailand, that are catering to Chinese tourists to get them Pfizer vaccines. Hong Kong, there's actually one bank that if you put, what is it? I think 4 million Hong Kong dollars, $500,000 US, into the bank, you'll get a Pfizer vaccine.
Wow. Better than
But
a
there are also
toaster, huh?
services selling the Pfizer vaccine, although they're quite expensive. I think they're selling it for on the order of $3,000, $4,000, which is outrageous.
Wow. Yeah. Okay. Well, like I said earlier, incredibly analytical, incredibly depressing. But thanks for having such a revelatory talk. And again, the timing was couldn't be better. And maybe we'll get you back in a year and have a recap of what's happened.
Sounds good.
Okay. Thank you so much. And